Hello everyone! Today we are going to talk about stomach ulcer. Have you ever felt a burning sensation or pain in the middle of your abdomen between your chest and belly button? Epigastric pain is one of the most common symptoms among people, which leads you to visit a doctor, which is often caused by an ulcer in the stomach wall. Stomach ulcer is one of the diseases that should not be ignored due to the possibility of complications, which in itself may be a sign of a tumor in the stomach. But do not worry. During this video, we will explain to you everything related to the stomach ulcers, their symptoms and treatment, in addition to possible complications. Our role today is to answer most of your questions regarding stomach ulcer. Today we have Dr. Choi, who is leading doctor at Korea University Anam Hospital. He's going to discuss with us everything about stomach ulcer from experienced medical point of view. I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Now we'll be talking about stomach ulcer. So what is stomach ulcer and how dangerous can it be?
Gastric ulcers refer to falling mucous membranes that wrap around and protect the stomach. If the gastric mucosa or mucosal tissue falls and the gastric mucosa disappears, it is called gastric ulcer. The gastric ulcer itself is not high at risk, but if the gastric ulcer occurs and this condition persists, it can be changed to gastric ulcer perforation. In some cases, gastric ulcers persist. Gastric blood vessels are exposed, and bleeding occurs. Blood may be vomited while vomiting, and in some cases, a patient visits a hospital with severe abdominal pain and is diagnosed with perforation. In addition, cancer may appear incorrectly as a gastric ulcer, so be careful when identifying the cancer.
What are some early signs of stomach ulcer?
Symptoms of gastric ulcers include abdominal pain and heartburn. Patients visit the hospital because of these symptoms. In some cases, despite the absence of symptoms, gastric ulcers may be found through endoscopic diagnosis.
The examination is done to diagnose stomach ulcer.
The diagnosis of gastric ulcers is basically endoscope. The endoscope determines whether there is a gastric ulcer or not. As mentioned earlier, there are cases of cancer, not gastric ulcers. So doctors should conduct biopsy to determine exactly whether it is cancer or gastric ulcers.
Okay, let's talk about the treatment of stomach ulcer. What kind of treatments are out there?
Treatment of gastric ulcers is basically medication. First, you have to take medication. In the stomach, there are aggressive gastric acid, drugs, and stress factors, and factors that defend against them. When this attack factor and defense factor are not balanced, they eventually develop gastric ulcers. So as a way to reduce the attack factor, if the drug taken by the patient is judged to have a gastric ulcer factor, change the drug. Use a drug that suppresses gastric acid, or use a drug that protects the stomach. Most treat them first in this way.
Is there any special diets that should be followed for stomach ulcer?
Things that can cause gastric ulcers are not special foods, but alcohol or cigarettes. And it's good to avoid spicy, sweet, or salty foods.
How can a person prevent stomach ulcer in this case?
Nowadays, as aging progresses, people take several drugs. Some of the drugs can damage the mucous membrane of the gastrointestinal liver. In particular, when taking anti-palate drugs using to improve blood vessels. This often causes gastric ulcers. That's why it's necessary to control the use of such drugs. As another factor, be careful of what you eat.
Today we learned many things about stomach ulcer, and the doctor explained in details everything related to its possible causes, symptoms, how it is diagnosed and treated. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.